A low histamine diet is awful. I'm just going to be honest. It is awful and it's a miserable diet. And I don't think it's something that somebody should be on for life unless it is absolutely 100% required.
We have all had that one patient, or maybe even lived it ourselves, where the skin will just not calm down. Chronic hives, random rashes, dermatographia. It's itchy, it's frustrating, and it feels like nobody has the answers.
Let's be honest, Googling it at 2 in the morning, it just makes it worse. So suddenly you're down a rabbit hole of histamine intolerance, gut health, supplements you've never heard of. So today we're bringing in someone who actually knows what she's talking about.
That's right. We're joined by Jennifer Fugo. She's a clinical nutritionist, licensed dietitian, and certified nutrition specialist, and the host of the Healthy Skin Show podcast with over 1.3 million downloads. She's built a whole practice around helping people figure out the root cause of their chronic skin condition. And honestly, she is here to answer the question your allergists probably don't even know how to answer.
From histamine intolerance myths to whether you can actually ditch your daily antihistamines, this conversation is going to be eye-opening and enlightening.
If you could only recommend 3 skin supportive foods to everybody, what would they be?
Actually, I'll give you one that I do not recommend because I think this is important. I do not recommend.
Jennifer, thank you so much for being here. It is such an honor. We are so excited to chat all the things with you. This is, like I was just saying, this is a super hot topic on TikTok and on social media. Everybody is talking about it, about finding the root cause. But I want to kind of start with the basics. So what exactly is histamine intolerance? And do you think it's really to blame for urticaria, also known as what people know as hives?
So histamine intolerance is traditionally thought of as an issue where somebody cannot process the amount of histamine that they have in their system. And so oftentimes it's looked at as a dietary fix. Histamine intolerance explicitly implies that there is an enzyme issue within the body that has difficulty, there's some type of difficulty to break down histamine. And I actually don't think that histamine intolerance is as big of an issue as everyone claims online. I used to believe that. That's what I learned when I went through my master's program. But I don't actually think that's the issue. What I think now is happening is that people have an issue with too much histamine to begin with. So it doesn't matter how much of the enzyme they actually have available to them. So there's an enzyme within the gut that breaks down histamine specifically, and then we have enzymes within our cells to be able to break down intracellular histamine. I don't think it's an issue for most people of a lack of enzyme or the enzyme not working correctly. I think it's just way too much histamine to begin with. So you almost become like a histamine production factory.
Okay. So when someone, I know you've worked with people like literally from all over the world. Someone probably comes in and they ask or they say, I have these mystery hives, because we get this all the time too. All of the time, people are always coming in and they are, the number one question is what's causing this? What do you tell people? What are the first things that you're looking for when someone has mystery hives?
One of the first things I'm looking for is what is driving this excess histamine production. So I'll give you a quick story. This is a real client that I've worked with for the last year. He's a teenager. He got braces on and developed full body hives after the braces. The parents flipped out because they thought, well, does he have an allergy to the metal? Does he have an allergy to the cement? What's happening? Right. Exactly. They went so far as to take the braces off.
Oh my.
And the hives did not stop at that point. So this poor young man, who is extremely active, plays sports, is really healthy, he was taking 2 doses of Benadryl every single night to sleep.
Oh my God.
And sometimes he would wake up in the middle of the night and have to take another half dose to get back to sleep. He would be out at practices and his socks around his legs, because it's compressed, would welt up. So he had this really intense reaction that they could not figure out what was happening. He didn't have any allergies. And so actually they saw functional doctors who were really perplexed and puzzled. My theory is that the braces created pressure to a point where It was like the straw that broke the camel's back, and he had some underlying issues that were driving this that were not exactly clear. And so when we looked beneath the surface, he had issues with H. pylori. So there can be some significant gut microbiome issues, and I can explain why this is significant here. But he had H. pylori in his stomach, which is a very common issue. He also had candida overgrowth within his GI tract. And I had this sneaking suspicion the entire time that there was probably some type of parasitic issue. Most likely, my guess was probably some type of helminth issue. And initial microscopic stool testing did not find that. They only found candida. We did a bunch of work trying to rebalance the gut microbiome, getting him helpful probiotics and all sorts of things. And then when they redid his stool test, that's where it showed up, where he had, they're called larval nematodes or baby worms, essentially, that showed up on the test. I can happily report that I met with him earlier this week. He has not had hives for 6 weeks. He is no longer on any Benadryl. He is back to normal, and his parents are thrilled.
So was it treated with like an anti-parasitic, or what was the treatment plan? And was that, I'm curious as someone who practices and sees this all the time, like, was that test covered by insurance?
So the testing was not covered by insurance, unfortunately, but it wasn't extremely expensive. I think it was somewhere in like the $200 range. And to be honest with you, a lot of times people are so frustrated. They're like, that's a reasonable price to pay to try to get some answers. Typically when that test finds something, I will suggest that the client go back to their doctor. Sometimes I'll write a letter to help explain what's happening. The testing does make some suggestions of like, here's what might be helpful from a medication standpoint, and the doctor can make the decision at that point if they want to treat the patient. And so in his instance, it included fluconazole, and I don't remember, it might have been mebendazole that they were prescribed. Before that, we were just using different herbs that have been shown to be helpful in rebalancing the gut microbiome. We also used other supportive nutrients and there are certain types of probiotics also that can be helpful, especially if you have excess histamine in the system, like Lactobacillus rhamnosus, specifically the A.G.E form, and using immunoglobulins, oral immunoglobulins to help. For some reason, and I do not know the reason why, but oral immunoglobulins, for some reason, they cause a nice reduction in the presentation and instance of hives and dermatography and all this stuff. And they also, for those who are very reactive to high histamine foods, over the course of like a couple of months, we'll actually notice that the individual can start to reintroduce foods that they could not eat before. Again, I don't know the reason why, but I've seen it again and again and again over the last 4 to 5 years. So it's really nice to be able to partner with a doctor who is open to helping their patient, because obviously it's a big quality of life issue. Yeah, I mean, I have a lot of stories of clients who have really been suffering, and they're working with their doctor. They're on a lot of antihistamines. They may even be on Xolair as well, and they're just not getting better. There's no real option for them. So there's the gut component, and then there's also the thyroid component. In this instance, this young man didn't have a thyroid issue, but sometimes you find that there can be some thyroid dysfunction, elevated TSH, maybe even Hashimoto's may be present with antibodies through blood testing. So
yeah, these are definitely all things that we check for when we have a urticaria patient.
Yeah, I mean, in conventional medicine, like we're taught during residency, 50% of cases are unknown, but clearly all cases have a cause. I just think that in conventional medicine, we just don't know all the other things to check. Like Lindsay said, like we check for thyroid, we screen for Hashimoto's. I do check for H. pylori and hepatitis because I personally think infection's a huge cause of hives. Like people who have these dormant infections that get activated, and it's like a virus that we maybe don't know how to test for. Right. Like you mentioned earlier, Jennifer, like parasites. And then, we'll do the typical screening for like their blood count, their complete metabolic panel, make sure all their organs are doing well. But I find myself, often referring to allergists too. And sometimes it's a complete mystery for them. So what are some other interesting things that you find? So you mentioned parasites and you talked about thyroid and gut microbiome, candida overgrowth. I think H. pylori is huge. And I also want to know what your favorite test is for that. But also, like, what are some other I guess they're not random, but other things that you look at, whether it's mold toxicity, looking at, and, things like that, their detox pathways.
Absolutely. So I do think that mold exposure in the past can be a factor. We kind of like to dig through cases because I feel like, so for those of you who don't know me, my dad was an ophthalmic surgeon and he was deeply, deeply curious. I mean, my dad had constantly had textbooks open. So he was always involved in research and was fascinated by the human body. So I was influenced by this throughout my entire upbringing until he passed away about 5 years ago. And so that really made me, it's always that curiosity, right? It's like, what could be underlying this? So, for example, I want to know in a client's history if they have had significant mold exposure. Or in one red flag is if you go on vacation and you do great while you're away on vacation, but as soon as you come home, the issues return. That's usually a red flag that there's probably a potential mold issue in the home. I like to be really careful about the conversation with mold because your home is a place where you want to feel safe. And there's a lot of information on the internet that's like, you have to leave your home, you have to throw away all of your things. And I don't know that living in a mold-free environment is exactly supposed to be the goal. And I don't know that that's realistic and practical. And not everyone can actually leave their home. And not everyone may need to. So I think we have to have some really practical conversations around mold exposure. Or if it's in the past, like say you lived in an old dorm during college, right? Many of us did. We lived in these old moldy dorms. And you had lots of pizza and lots of beer and alcohol, and you didn't have a great diet. That certainly is going to influence your gut microbiome, at least from a more integrative perspective. And that could lead to something down the road. So I do look at mold exposure. I also find it's really fascinating, in addition to H. pylori, there are certain bacteria as well that produce histamine. So one specifically is called Morganella. And if you do any research on Morganella species, it typically, if it infects fish, it will produce so much histamine that it can actually kill the fish. Now, that does not mean that if somebody has this show up on a stool test, that they're going to die by, we're not fish. But it is important to note that some bacteria like that, Proteus mirabilis, different Klebsiella species, not specifically Klebsiella pneumoniae, it's more the Klebsiella species that might show up on some stool tests. They also produce histamine. So, the H. pylori is a factor. For some reason, it's so connected with not just hives and dermatographia, but we see it often in eczema and psoriasis and rosacea. So I think it's worthwhile to really look under the surface and to consider, is there a way to go, hey, it's not necessarily that I can't tolerate all these foods, because the diet piece is a big piece to this. It's literally that I'm producing histamine and I can't walk away and go to bed and separate myself from that. It's going with me.
So we talk a lot about healthy skin from the inside out, but sometimes your skin needs a little extra science-backed support. That's why we're so excited about SkinCeuticals A.G.E. Interrupter Ultra Serum.
Yes, this double patented serum is clinically proven to visibly lift skin up to 18% and reduce wrinkles by 16% while boosting smoothness by 54%. It targets 4 key areas from face to neck for that firmer, more sculpted look that we all love and strive for.
And it's not just about lines and sagging. As our lives change, whether it's age, weight shifts, or lifestyle, our faces sometimes have a hard time keeping up. Think of this as a facelift
in a bottle that's dermatologist tested for all skin types and tones.
For even more powerful results, it can be paired with the A.G.E Interrupter Advanced and in-office ultrasound treatments, an integrated approach that's been physician tested to reduce skin laxity.
And we've been genuinely impressed by how elegant this formula feels and how visible the results are. If you're ready to give your skin that lifted, resilient glow, check out SkinCeuticals A.G.E Interrupter Ultra Serum.
Get facelifted with A.G.E Interrupter Ultra Serum, a visible lift in a bottle. Find it at SkinCeuticals.com. I have 2 follow-up questions to that. Number one, the bacteria that you mentioned, is it usually just an imbalance in our gut, or is it maybe kind of from food? Because you mentioned one is found in fish. So like with eating certain type of food or particular diet, kind of increase that level of the bacteria. And then 2, have you had instances where you do really thorough testing, but really haven't found anything conclusive that may be the trigger? And in those situations, how do you approach those patients?
So one thing that I will share is that, especially with H. pylori, this is one of the ones where I think our testing methods on all fronts kind of aren't the greatest. I know that the stool antigen test is considered kind of the gold standard, but one thing my dad always told me, because he had some really, really weird cases with patients of his, he's like, testing is not always 100% correct. And sometimes you have to look at other pieces to determine whether what is happening is that negative on a test really accurate? So when I look at somebody and I'm like, gosh, they have heartburn, they have low iron, they have historically low B12. In fact, they need B12 shots to even be able to maintain a healthy B12 level. They struggle, and we look at maybe a more functional stool test that looks at their steatocrit, so the marker of fat loss in the stool versus pancreatic enzyme output. We start to look at different things and it's like, I think we might have an issue here. And so I like to be really straightforward with clients. If I don't see anything, but I suspect it, I want to present to them the reasons why I think this might be a factor. I recognize that makes it difficult. So like going back to a doctor and getting, for example, treated with medications for H. pylori is probably not going to happen because they don't have any proof of it. And I understand that. We want to be judicious with antibiotics. I certainly understand the consequences of over-treating with them. But that's where we have some of these other herbs and different things that we can do, combinations that have some clinical data showing that they can be helpful in reducing the amount of that organism present. One thing I will say is I don't entirely understand why, I think parasite testing really stinks. A lot of research that I've read, especially because I have a whole spreadsheet on parasites. I'm just like fascinated by them. And I read research studies of different things, looking at the instance, for example, of amoebas and how often they show up in urticaria. And, what's really interesting is that they will note that sometimes they have to do 8 to 10 different stool samples before they'll actually find something that's positive. So, the other factor too is, and you asked this question about, well, how did the organisms get there? Is it just because they overgrew? Is it because, what happens? If we have H. pylori, so that's first. And then you can also have low stomach acid that could be due to other factors like low levels of certain minerals like sodium chloride, zinc. It could be due to chronic stress where the body can't get into that rest and digest state. Either way, stomach acid is a really crucial step in our digestive process. It acts not only to break the chemical bonds between nutrients, specifically minerals and proteins, and the bonds between amino acids, but it's also a chemical barrier. If the chemical barrier is gone, everything you swallow, everything you inhale that's coming down the throat, right? Everything you eat and drink is going to pass through the stomach and unfortunately can contribute to issues like small intestine bacterial overgrowth and other organisms that we start to find within the intestinal tract. I will also say, and I get it, I'm not a gastroenterologist, but because I work closely, especially with some doctors like Dr. Peter Leo, I do work with some of his patients. there is this idea that you have to have severe diarrhea and nausea and all these really significant symptoms to have a parasitic infection, and that's not true. You can be constipated and have parasites, and a microscopic stool exam, as far as I know, is not gonna lie. They saw it, they visualized that. So I think it's worthwhile to reconsider when we talk to people, like, where have they traveled to? A lot of my clients have traveled to Peru, to Bali, to India, to Morocco, to places where they admit they either got sick or they were eating local food, they came back, and they've had issues ever since. And at that point, it's like I'm trying to help them determine, like, what's the best way forward? How can we coordinate and get their doctor involved, whether it's their PCP or their gastroenterologist, or even sometimes a dermatologist will be really, really helpful with this, because ultimately they want to get their life back. Nobody wants to live with this.
I think it's so fascinating because I find most of the time when I'm working up an urticaria patient, it's very unsatisfying because of the basic tests that I do that I often don't have an answer. And of course, I also believe, like you said, there's probably something that tipped them over and they're now creating all this hive, but it's always, the basic labs I do, I rarely find anything. So I end up just kind of treating the patient. So this is very eye-opening to consider other, workup, especially looking at like the gut aspect of it.
Yeah, because I had mentioned earlier the DAO enzyme, so that's short for diamine oxidase. That if we had true histamine intolerance, it would imply that the enzyme, for some reason, whether it's a genetic SNP, so maybe it's just not as robust, it's not operating as efficiently as it normally would, should break down histamine and degrade it. And histamine can come from food and all sorts of things. But this is specifically for what comes through the GI tract. The problem is, and the other reason too, I will add to this, is that we need copper in order so it's a cofactor for DAO to operate correctly. So if you're, for example, over supplementing with zinc, which we know throws off the balance of copper in the body, that can kind of crowd things out. So we will obviously want to be really careful with supplementation, and that's why it's good to really dig through what are people taking and how much are they taking of these things. But realistically, I've had so many clients buy the DAO enzyme, which you can get in a supplemental form, and they don't get any better. They've taken it for months and months thinking that they were somehow like building the level up, which is not how this works. It's a supplement. Enzymes are one pass through. They wash through the GI tract. And so I think at that point, when you're on a lot of antihistamines and they're really not controlling things, when you're trying to take DAO enzymes, they're not helping, I think it's worthwhile to also consider the severity. I've interviewed Dr. Mariana Castells, who is a really brilliant doctor who studies mastocytosis and runs the Mastocytosis Center in Boston. And I think there's a lot more that we can help people with, because as this gets worse and worse, it's really debilitating, where people can't go to work. You can't go outside. You can't exercise. Some people can't go out in the sun. They can't wear clothes that are tight. I mean, it's really awful.
It really sucks. And yeah, as derms, sometimes, like Jenny said, we feel kind of helpless because we feel limited. And I know a lot of derms listen to this podcast, and I would love for them to get these other extra tips. I know we're not trained to test for some of these other things, but so you look for mold, you look for parasites, you look at the gut. There's also detox pathways that you look at too. So in what situation would you look at something like that, and how do you assess that in patients? And can you talk about that a little bit?
Yes, absolutely. So the liver detox pathways are really important. Specifically so there's phase 1, phase 2, phase 3 detox. Phase 1 is predominantly governed by genes. And obviously you're probably familiar with this because certain medications like cyclosporin, if you start taking, I think it's grapefruit, that's going to be a problem for how your body processes cyclosporin. Phase 2, those detox pathways are heavily regulated by the amount of nutrients available to them. They require amino acids. There's one actually called the glycine cleavage system that requires glycine, which is an amino acid, in order to repackage different toxins. What is crucial to know about this and the reason this is important is because what goes through phase 1 detox is predominantly like lipid and fat soluble toxins and things. That's why steroid hormones are processed through phase 1 because they are more lipid based. Whereas water soluble go through phase 2, but both. So if you go through phase 1, you got to go through phase 2, but not everything has to go through phase 1. And so benzoates are a byproduct of organisms that are in the GI tract. And we might think, okay, well, they're in the GI tract. Don't we just excrete them through stool or through urine? And we don't. They actually have to be processed first in order to be converted to something that the body can excrete. And benzoates specifically need to be repackaged through the glycine cleavage system. So as that burden increases, we need higher doses of glycine to be available. It's sort of like Lucy and Ethel in the chocolate factory when they're trying to wrap the bonbons and the line speeds up and they're putting the bonbons in their mouth, hats, blouses everywhere to try and hide the bonbons. But it's similar to that. So you could try, and I welcome anybody to do this, but I've tried it and I don't think it works. We've never seen it work. You could try increasing glycine-rich foods like collagen, for example, into your diet. However, I never saw any change to any of this until we tested out just supplementing with pure glycine in the amino acid form, like a supplemental powder or the pills. And that's when we started to actually see improvements because you need the benzoates, those waste products, to be processed. You also need to be able to methylate certain things to also get rid of different things. So we have like a bunch of different pathways, but I find mostly that if you're dealing with this, if you add in supplemental glycine, typically people start to notice within like 4 to 6 weeks that they'll have some improvement in things. They're not as reactive to the world around them. I'm not saying it's going to improve your allergies and make your hives go away. I'm not saying that at all. But they just find that it also helps them process salicylates if they seem to be reactive to salicylate-rich foods, because salicylates are actually technically a toxin that's processed not in the GI tract, but in phase 2 liver detox because of glycine. And so we don't make glycine. We really need to increase that level. And so that's one reason why I do find that some level of amino acid liver support is really helpful. And also just vitamin B6 can be supportive of the ALT and AST enzymes. You just want to be careful how much you supplement with because you can develop toxicity to that. So I like to, if you're not working with somebody, I usually say, hey, somewhere between like 15 to maybe 25 milligrams of B6 is probably like, if you're on your own, that's probably fine. Beyond that, you should have somebody look at your labs. So, and the glycine is like higher doses, potentially anywhere from 3 to 10 grams additional a day.
So B6, glycine. So can you talk a little bit more about, I feel like this is a very common interest amongst listeners and just the public is, food and diet and supplements. Can you expand a little bit more about low histamine diet? Is that a thing? Does it actually work for people that struggle with hives? And then more just on the supplements, you also mentioned probiotics and then the oral immunoglobulins that I'd love to learn more about that. Even brands that you recommend.
A low histamine diet is awful. I'm just going to be honest. It is awful and it's a miserable diet. And I don't think it's something that somebody should be on for life unless it is absolutely 100% required.
What kind of foods?
Yeah.
What's on a low histamine diet that would make it miserable?
Or what foods are high in histamine that should be avoided?
Well, no, because this will give you a sense of how miserable this could be. If you are really seriously that sensitive, you can't even have leftovers. You can't do protein powder. You can't do collagen. Yeah, you can't have no leftovers. So the moment you finish cooking food, you have to put it in a container and freeze it.
Wow. Why is that?
Yeah.
Because the moment that you stop cooking food, the histamine levels naturally start increasing. So that's the most right. So there's this spectrum of how severe are you? And so things like a lot of times citrus can sometimes be problematic. Fermented foods, anything canned would be a problem. So aged cheeses and meats. You can't have vinegars. I mean, it's yogurt, sourdough bread. They're all fermented. So it becomes really challenging. A lot of people find it to be miserable, and I don't think it fixes the issue. So it can help reduce dietary histamine. But this was one really fascinating thing that I learned from Dr. Castells, that the amount of histamine that's actually in our regular diet is like 10% of the total amount of histamine that is that we would normally find when you have these like histamine problems, especially as you're getting into like mast cell activation syndrome, mastocytosis, etc. So she's like, it doesn't work for everybody. And I will agree, as a clinical nutritionist, sometimes the diet doesn't actually work. And at that point, I'll just be like, okay, just keep eating as you're eating. Let's deal with the other things. I had one client who had full body hives and angioedema, and she was so miserable. I felt bad. One day she got on camera and was pulling her, neckline to show me literally how bad and welted up she was. And, in her instance, a little thing that was interesting about her case, and I've only seen this 2 or 3 times, she actually had a form of Yersinia in her GI tract as well as Candida. And so the doctors treated her with antibiotics for that. And that and the antifungals actually made a huge improvement. She was on 8 doses of antihistamines a day plus Xolair, and it wasn't controlling anything. She's off all her meds. She has no hives.
Wow.
So I think there's a lot to think about. I think the goal, the low histamine diet can be a helpful tool possibly, but I don't think it's not going to fix the gut microbiome. It's not going to get rid of these unfriendly organisms. And I think we have to think about, how do we nourish somebody to make sure that their body isn't constantly in this state where it's burning through nutrients to try to deal with some type of emergency that we can't necessarily see or pinpoint.
So then are there say 2 supplements that you universally recommend to patients who experience this as a helpful adjunct to treatment?
Yes. So the first thing I would say, actually, I'll give you one that I do not recommend because I think this is important. I do not recommend that clients who are dealing with this take betaine HCl. I know there's this really big push to increase stomach acid, but you all probably know that sometimes you may treat your patient with famotidine and some of these others that are used for heartburn medications. So actually increasing your stomach acid can oftentimes make people worse. So I don't recommend that. If you need digestive support, just a regular digestive enzyme is probably a better way to go. Some people might also be reactive to papain and bromelain, which come from pineapple and papaya. So you might want to just stick with just straight up enzymes. But I really I mentioned those immunoglobulins. And then I think bioflavonoids, so quercetin can be really helpful. There are quercetin rich foods. Usually they are things that are more reddish in color. So red onions, blueberries, that kind of stuff. But you can also supplement with quercetin as well. I think vitamin C can be really helpful, but just know that taking any a tablet or a chewable of vitamin C beyond 500 milligrams, you're only going to absorb up to 500. It's sort of the max absorption at one dose. So if somebody needs more than that, a liposomal form would be a better form to go with so that you can absorb higher rates and higher levels of the vitamin C. And then bioflavonoids like rutin can be really helpful. Some zinc can be helpful, but we want to make sure to balance that with copper. And then I love teas. I think teas can be really easily integrated into somebody's life. So nettle tea and rose hips tea are both really nice. Nettles is helpful to kind of calm histamine type things. And then rose hip has a lot of vitamin C in it.
How does vitamin C work? Is it just an antioxidant, antimicrobial, or
It's definitely an antioxidant. I think that, I don't know the exact mechanisms. My understanding would just be that it helps to help, like zinc does too. They help to kind of stabilize mast cells, because it's that you have this production of histamine that may be coming from some exogenous or outside source, right? Could be from bacteria, could be from food, but also you have this issue of what happens with mast cells. So, it does seem to be helpful. The immunoglobulins are typically bovine serum derived. There's one company only, I think, in the world that makes them, and they're here in the United States. And so they make a product called Immunolin, which is encapsulated in a bunch of different supplemental brands now. And typically the lower doses that are recommended on the bottles aren't always that helpful. They're really great at binding to lipopolysaccharide toxins that are produced by certain bacteria in the GI tract. Again, I've asked them repeatedly, I'm like, do you know why they might be helpful with somebody who's dealing with histamine? They don't know. There's no research on that at this point in time. But they're really easy to take. They just can cause a little bit of more constipative stools. So if that's the case, you want to drink an additional 16 ounces of water when you take them. But you wouldn't be able to take them if you had an allergy to, obviously, if you had the alpha-gal allergy or you have a beef allergy. But they're not they're non-dairy because they're serum derived.
Do you still do consultations nationwide, or do you only have licenses in certain states?
So we consult on cases all over the world, actually. So we'll work with people depending on what their level is. Sometimes it's just reviewing a case and providing our feedback. And if we're allowed within that state, we'll work with them in a deeper capacity. But yeah, so it just depends on where they live. But we do everything. My clinic works with people virtually from everywhere. I've worked with people in countries all over the world that are drastically different time zones because they're looking for a different perspective. I think the one blessing from my dad was this just curiosity, and I'll listen to their story. I oftentimes don't like to have the video on when I talk to clients. I like to just listen. And sometimes I hear the things in their story and I'm like, tell me more about that. Explain this. And usually it's in the details that they think are irrelevant where I'm like, ooh, that sounds interesting. And they're so desperate at that point that they just want to figure out what's wrong because they want to get better. So, I don't take insurance, but my clients are dedicated to their health. They know that this is impacting their life. They can get back to eating a normal diet. They can get back to doing sports. They can get back to doing all sorts of things. And so I just do my best. And I love it when I can coordinate with their physician because I feel like herbs are great, but if somebody's really suffering, medications are so much faster. And I love it. I know that you don't always have these exact answers, but I don't know, to just sit here and go, I don't know, I don't know that we're I don't know that we're really helping people that are just I want my life back. At that point, I think we can keep on asking questions. And so I think I love that I get to continue to apply that curiosity my dad stoked in me as a kid and into my career to be able to do this. So I really enjoy it. And I love helping people just go, yeah, I'm off all my antihistamines now. And I'm like, that's amazing.
Yeah.
Yeah. I feel like you're giving us hope as derms. And,
Yeah. Sure.
and I think it just only, promotes this idea of just treating a patient in an integrative way. I'm so thankful for the conventional medicines. People need to be on antihistamine so that they're not suffering, or even Xolair. But recruiting somebody like you to also just help figure out what's going on deeper down, past what we are able to figure out, I think that could be super helpful. We are coming up at the end of the show, but we wanted to ask you just some fun, light, sort of quick, punchy questions. Okay, so what is one myth about hives that you wish would disappear from the internet forever?
I really wish that people would stop trying to get rid of their hives with just the diet. I do. I like food. I like to be, I mean, you all travel. I follow you all and you go to these amazing places. Like, could you imagine not being able to eat any of that?
Well, I mean, on the same subject though, because we're going to get this question, you're going to get this question. If you could only recommend 3 skin supportive foods to everybody, what would they be?
I would say cold water fish, dark leafy greens, and blueberries.
So many antioxidants.
I know.
Yeah. Love that.
And then lastly, one piece of advice you give someone who's currently living on a daily antihistamine.
I would start to think about what could be going on under the surface, and that maybe symptoms in other parts of your body are actually connected to that, especially if I think it's important to rule out allergies, like especially IgE allergy. Like I have clients that are like, oh, I had this terrible reaction to beef. I'm like, go to the allergist. Like, please go get seen by your doctor. Don't just like, because you never know, you could be out and then you have something and then you don't have any medication and God forbid it's anaphylaxis. Like, we don't mess with allergies. But I think that is the one biggest thing. And the other thing I'll share briefly is just be careful with taking too many foods out, because what we are seeing is that clients who have taken out a lot of foods, and especially if you've heard that like, oh, eggs are bad for eczema, I'm going to take out dairy because I heard that it's really bad and triggering for this and it's high in histamine and whatever. We are seeing an increased rate in adults who are developing adult onset like anaphylactic type allergies to top 8 allergen foods. So there's some research in children that they are seeing this, but nobody's actually looked at adults. But we've had one client who this happened to her. She can't even have eggs cooked into something. She has to have an EpiPen with her. We have another client who cannot have any dairy and was fine before removing it. So I think we have to use caution in how elimination diets can feel really easy and controllable, and I get it. I'm not saying that they're not a helpful thing, but we really got to be careful taking things out for an extended period of time. It seems to be somewhere around 10 to 12 months where that possible switch could get flipped, and then you try and reintroduce it and all of a sudden you have this like crazy allergic reaction. And at that point, it's hard to go back.
Thank you so much for bringing so much clarity. This could be such a frustrating condition. And I think that you're just giving more people hope that there's more to look at and more options and treatments out there.
There definitely are. And I appreciate all of you for being so willing and curious to explore it, because there's so much. I love science and I love learning. And I love, like I said, become curious. I think that is one of the greatest gifts, when we can become curious about what's happening to our health. And my goodness, I mean, like I've like almost 400 episodes of the Healthy Skin Show that are going through this. So I have a lot more, if anybody is interested on this topic, diving into different nuances about it on my podcast as well. Thank you so much for having me. I really appreciate you all.
And to our listeners, if you've ever felt dismissed or confused about your skin, we hope this conversation gives you some new tools to explore. Don't forget to check out Jennifer's podcast, like she mentioned, The Healthy Skin Show, and her Quell products at quellshop.com. And of course, subscribe, share, and we will see you next week on Skin Deep MDs.